Hi, so this is my presentation on bipolar disorder. So bipolar disorder is a serious psychological disorder that manifests through mood abnormalities. So it's a mood disorder. It's specifically characterized by alternating states of mania and depression. And I actually chose this topic because I was diagnosed with bipolar type 2 disorder 5 years ago, and it was so great to finally figure out, why I was feeling and doing the things that I was doing. It's always nice to learn a little more about it. So first, I want to talk about the difference between mania and depression. So mania is a state of euphoria. A lot of people having manic episodes feel like they don't need any sleep at all, or feel like they need just very little sleep. They tend to have decreased sexual inhibitions. Their speech tends to be very, very loud, very abrasive. It's very hard to interrupt someone who's experiencing a manic episode. And basically, they'll take a lot more risks without taking into account any sort of consequences. And then depression is more commonly understood. It's, feeling worthless or hopeless. It's increased anger or irritability. Some people experience insomnia, or so lack of sleep, and then some people with depression experience excessive sleep and sleep too much, and then also see suicidal preoccupation or ideation. So I have this little diagram that I made that shows all the different states someone with bipolar disorder can go through. And I'm going to use it to explain what the difference between type 1 and type 2 is. So type 1 is someone who's going to experience severe mania, hypermania, and they might, possibly experience some moderate depression, or they will. It's just pretty mild. And then type 2 is someone who's going to experience just hypomania, and they'll have severe depression. So the difference between these two would be, for example, because I experienced hypomania, I was in college, and this was before I knew anything was, that I had it. But I used to stay up all night studying, which seems pretty normal, but I used to write sticky notes and write just all my notes over and over again. I would laminate them, stick them all over my dorm room. My dorm room was covered in these notes, and I would, be brushing my teeth and like reading my notes out loud. And I was just so obsessed with my notes and studying. And I just felt like I was super smart and, which, isn't very dangerous. But, someone with severe mania, someone going through a very manic episode, a hypermanic episode, might be with a group of friends and say, how much you bet I could run across 6 lanes of highway traffic and not get hit? They just have absolutely no regard for any sort of consequences or any sort of risks. And then another thing is there is a mood disorder called major depressive disorder. And down here, I say that, someone with bipolar can experience a major depression episode. And the difference is major depressive disorder is someone who's going to experience an episode of depression that lasts like 2 weeks or so, and then they go back to a normal balance way of feeling or emotion. While someone with bipolar disorder, when they have a major depressive episode, once they're done with that, they start eventually cycling back up to mania. You do go through balanced phase, but you do go through all these back up to here. So now I want to talk about the biology behind the disorder. It's been found that it runs in families. A lot of studies have shown, and twin studies have shown that If an identical twin has bipolar disorder, the other twin has a 7 out of 10 chance of having bipolar disorder as well. And some scientists grouped all this data together and found that they estimate heritability of bipolar disorder in these twins to be 40%, which is very, very high when you take into account all the disorders. I mean, not disorders, all the studies. And then looking at brain scans, someone with depression has, pretty low brain activity, while someone experiencing mania has excessive, hyperactivity in the brain. And you'll see a lot of activity in the left frontal lobe, and there is an adjacent brain reward center that's also very, very active. Researchers have also found that there is low connectivity between two brain regions with people with bipolar disorder, and these two brain regions are one that regulates emotion and one that just deals with emotion. So basically what I'm trying to say is low connectivity between the part of your brain that deals with emotion and then part of your brain that regulates your emotion. They don't talk to each other very well. So that's why people with bipolar disorder will cycle, because these two parts of your brain aren't communicating. And so you're kind of just all over the place. And then there are two neurotransmitter systems involved in bipolar disorder. The first one involves the neurotransmitter norepinephrine, and norepinephrine is that fight or flight, kind of neurotransmitter. So you see a lot of it during mania and not so much in depression. And it's the same thing with serotonin. Serotonin you'll see a lot with someone during mania and not so much with depression. So that leads right into the different treatment options for bipolar disorder. The first one being an SSRI. It is a prescribed medication called selective serotonin reuptake inhibitor. And so basically what that means is your neurons will reuptake serotonin. And this particular drug will stop that from happening or slow that down so that it stays in your system longer. There are also drugs that, instead of inhibiting that process, it'll just inhibit the enzymes that break down serotonin. So, you still have serotonin in your system. There are also mood stabilizer drugs that are actually anticonvulsant medications. So, someone with that experiences seizures, their brain is very active. They're experiencing hyperactivity in the brain, which is just like someone going through mania. And so these medications can help decrease that hyperactivity. And this, mood stabilizers are usually prescribed to people who will experience 4 or more cycles in a year. So someone going through rapid cycling. Another treatment option is therapy, cognitive therapy. That's what I used to do. And a lot of psychologists and psychiatrists recommend therapy and prescribe medication at the same time. And in my experience, there's some psychiatrists that won't prescribe you medication unless you're undergoing therapy. And then the last thing that you could do to help treat the symptoms of bipolar disorder is exercise, running especially. I guess when you run, it increases your serotonin in your body, which, will help you when you're depressed. And that's my presentation.